Hi, my name is Allison Richardson, and I am making my clinical reflection for Castle 2. My clinicals for this term were online. Describe the nursing situation you encountered this week. There was a 74-year-old woman who was admitted to the floor from the emergency department for generalized abdominal pain, back pain, and pain upon urination. The emergency department had a diagnosis of a UTI with a new onset of confusion. Describe your relationship with the patient at the time you noticed the situation. So this was a new admission to the floor, and that's when I became aware of the situation. Consider experiences that you've had that helped your previous nursing care in this situation. So I used to work at a nursing home as a certified nursing aide. I have experienced the signs and symptoms of UTI, and it happens quite often. When I received report from the emergency department stating that the patient came in with the generalized abdominal pain, back pain, and burning upon urination, I automatically thought of a UTI, and before they had told me the diagnosis, and was before they told me the diagnosis, what the ER had. Describe your beliefs about your role as a nurse working on the situation. So I believe when working in the situation, you must use active listening towards the patient. Your nursing assessment on the patient will drive the plan of care, and also when asking the patient questions, allow them time to answer. The patient's already frustrated because of the pain of the UTI and with her having that new onset of confusion. Describe any emotions you had about the situation. So I had sympathy toward this patient. It reminded me when I was in the nursing home and took care of patients that had similar situations, as this patient did. It also reminded me of my grandpa and how he had a UTI and how confused he had gotten. So there was definitely some emotions toward this patient. What did you notice about the situation initially? So when I first encountered the situation, I noticed how forgetful she was when I began asking her questions about her medical, family, and social history. Describe what you noticed that you spent more time with the patient and or family. As I spent more time with the patient, she was very upset. She felt like she was losing her mind, and she stated this is definitely not her normal. Describe what you thought about the situation. So this cause seems to stem off similar patterns this patient has had before with the UTIs. Potential resolutions were going to be antibiotics and something for her bladder control, and definitely hydrating. She was having tinting, so we definitely needed to give her fluids. Patterns that were noticed when gathering her medication list, I found out that she was taking 2 statins at home. Describe any similar situations you have encountered in practice before. So as I stated earlier, I used to work at a nursing home, so I've witnessed the classic signs and symptoms of UTIs. Describe any similarities and differences you observed when compared with the current situation. Similarities compared with the current situation was the new onset or increased confusion. Differences compared with the situation were not really evident to me, although with this certain situation, I think with her taking 2 statin medication, it did increase her confusion more than it would just with a UTI when you would see with a patient. What other information did you decide you needed to consider the situation? Another information I decided I needed with this given situation was the evidence of her taking 2 statin medications from when she was describing what home medication she was taking. I consider this to be very essential. When taking 2 statin medications, it can increase the mental state, the neurological issues, and it also can increase liver damage, which explains why her liver enzymes were so high. What did you observe, or what did your observation and data interpretation lead you to believe? So when observing this data, it led me to believe that she was having some liver damage. It was reported by the labs that were taken, which resulted in high ALT and AST and the liver enzymes, and it also increased her confusion. After considering the situation, what was your goal for the patient, family, and or staff? So my main goal for the patient was to treat her for her UTI and monitor her mental status. Also, pain management and the importance of hydrating her. What was your nursing response, or what interventions did you do? So interventions that were done were monitoring her mental status, monitoring for fever. Bed rest was put in place with toileting every 2 hours. Also, if she did want to get up, she needed to have an assessed due to that fall risk. Describe stresses that you experienced as you responded to the patient or other involved in the situation. So there wasn't really necessarily any stressors that I had experienced. How did the patient, family, and or staff respond? So it was really kind of hard to tell with how the patient responded due to it being an online simulation. So yes, that is it. So thank you very much.